All right. Speaking of partnerships and community, our next speaker has long been rooted in advancing health equity in San Diego County. Amina Sheikh Mohammed is the director and founder of the Refugee Health Unit at UC San Diego. And in case it hasn't been mentioned yet, UC San Diego is one of the partners that helped us put on this conference today. So many thanks and a big welcome. Thank you.
Assalamu alaikum and good morning, everyone. Thanks, Martha, for mentioning the emotional, right? That's how I've been feeling this morning, but for happiness, really, to be with all of you. I'm so grateful for the partnership with Public Health Institute and to co-host this event with all of you. Thank you so much. My name is Amina Sheikh Mohammed, and I am the founding director of Refugee Health Unit at UC San Diego Center for Community Health with ACTRI. And today I'm going to talk about Afghan Refugee School Impact Program and Afghan Youth Mentoring Program. I'll slightly touch those points because we do have presentations later or in the afternoon. Within the Center for Community Health, we have been working with all communities for over 30 years. And within that, we founded Refugee Health Unit 2017 in response to partnerships with communities in San Diego, asking us what will be the university doing, how can we partner, one grant after another grant. We wanted to make sure that we were prioritizing those communities' continuation of programs. And our mission is to advance health equity and well-being in refugee and in immigrant communities through culturally responsive approaches. And our vision is thriving refugee and immigrant communities embraced by equitable and inclusive system. So we want to make sure they're included in the system and all the time. And this is our team picture. We're missing a few of them though. Our approach is building cross-sector partnerships that aim to improve health and well-being of refugee and immigrant communities. And in this one, we also want to work with providers, different sectors that are supporting the refugee communities, as well as the and immigrants, as well as the ethnic-led organizations. So we're like the bridge between both. And we focus on research and evaluation, professional and leadership development, communication and connection, and also coalition building. I want to touch a little bit about our model, for our Center for Community Health, and it's community-led. So we really focus on community-led work with our communities. And what that means is community is leading the work and we're kind of supporting whatever that is, however that is. And we also co-design and co-create programs with the community. So starting from curriculum development, program design, grant applications, everything is more technical assistance to the organizations. But they're the decision makers. They're co-designing with us. So really, we want to uplift ethnic-led organizations there. And then partnership-based and trust-driven, right? So trust takes a long time. Like I said, we've been working with the community for 30 years, but really stepping back and just listening, right? And building that trust continuation. Cultural humility, we're trying not to be cultural competent on anybody's culture, but we want to be openness and learning from each other, all the time. Each culture is different, unique, just meeting the community where they are. And healing-centered approach, so that it's more of basing meeting the community where they are, building up that resiliency and listening more of it. Strength-based and learning, we're focused more on the resilience, what you already know, and then we add more to that. So we don't look into the what's missing, right? But you can do this, let's start that way and really meeting the community where they are again. Adaptive and responsive is community's priority. They have the priority to let us know what they're focusing on, and we follow through that. Sustainability. Sustainability to us is not about only resources and funding, but it's this network, right? How do we keep building up this network and continuation and referrals happening and so on. So if one program is ending, yes, let's look for more funding, but what do we have to continue that relationship and that partnerships? How can we connect it more to school districts, right? Like how can we connect to existing resources that are there? So it's more about that. And community ownership. All these projects are not ours. At the end of the day, it belongs to the community. I want to show you this photo and also highlight our work with San Diego Refugee Communities Coalition, which is the model that we're using, this model that we're talking about. It's in action with the community. So we have practiced for the last 5 years with San Diego Refugee Communities Coalition. So one example is that RHU facilitated the development, the Refugee Health Unit facilitated the development and provided support to the coalition, initiating a lot of the things in the beginning, but it's not a UC San Diego program, so the community owns, right? So making sure that it's very clear, the community owns, but the collaboration continues. And collaborating funding. I didn't mention, but the San Diego Refugee Communities Coalition is 12 ethnic-led organizations, and you can only imagine sharing funding, right? We're talking about from a couple of hundreds to $1 million funding. What that means is like we're trying to minimize the competition. We're trying to minimize and make it more like collaboration. So it's not about funding only, but it's about how do we support the communities because the community should not know about funding and so many things that go behind the scene, but we want to make sure that they're getting services that they need throughout. So collaboration, 12 ethnic-led organizations sharing funding, it's been a very successful model, rotation of funding, like who's going to lead and all of that. There's a lot of work that goes into it, but it's doable and we want to share with you, and hopefully we can share more another time, more in depth about this model. And adaptive and responsive. So from the grant that we apply or programs that come to the community has ownership of it, and it's their priority. So we cannot just bring one program to say this is what it is, but it's like, it's often times coming from them, or it's in consultation with the community, so they have that ownership. And this is a photo of our ethnic-led organizations and a couple of staff members with us. Valerie Nash is there too on the photo. Now I want to go into ARSI, and really talking about that model with SDRCC and that vision is what led us be partnering with CDSS on the ARSI AYM program, because we have done that and we want to scale it up to the state and see what that looks like. And right now, that's what we have been doing, and helping Afghan youths and families succeed. Later on, we'll have more presentations about this, but there's a few things I wanted to highlight. Connecting Afghan youth and families resources to support to succeed academically and socially. And we're doing that in 5 different areas: early childhood development, family engagement, mental health and well-being, services to school-age children, youth mentoring ages 15 to 24 is what we're focusing on. And our other goal for this program is really to uplift ethnic-led organizations, small to large, right? Like building up the capacity of the ethnic-led organizations. What we have here is that photo you see is San Diego collaborative meeting. So get them together, find that space, find collaboration, who's doing what, which event, space for the ethnic-led organizations to talk on their own, and establishment of community of practice. Our community of practice is also, we always invite like members within the coalitions to co-lead with us on that lessons. Like some of you are here like that who presented into the community of practice. So we don't look for experts from outside, but we have our experts within. And provision of training, technical assistance, like so many things about, of course, you can think about financial, right? Like budgeting and everything. It's focusing that, building that capacity. And I think we took a responsibility to do that, and we're seeing it super successful, and we're excited that, yeah, we want to prove that ethnic-led organizations can lead, and they're able to do it, right? And build it up for them to apply large resources on their own at some point. Our statewide approach, continuation of that, is UC San Diego is in the middle, kind of like coordinating, but we really partner a lot with regional leads. Our regional leads is CARE San Diego, CARE Sacramento, CARE LA, or CARE, yeah, and CARE Sacramento, CARE LA, and CARE in the Bay Area, and then SDRCC for San Diego. We work with our sub-awardees, and then statewide coalition. So there's a lot of movements, but there's space for small regional level meetings, statewide collaboration and coalition, regional leads kind of being like very focused into the regions that they're serving, and providing that one-on-one, trust-based technical assistance as needed. And then for all of us to come together. So this is what I mentioned, like kind of getting emotional about this whole network of things, because I've been doing this work for so long, but I haven't seen this to this level. So I'm really excited about what we're, where we are heading with this work. Our statewide implementation and accomplishments is 4 regions, like I mentioned, and we had 45 sub-awardees, 80 projects, and 160 new programs. Like we're talking about, these partners did not work. Maybe they worked a little bit together, but they were not in a one network, right? They were not in one coalition before. So creating those coalitions has been really successful in those areas. And together, they reached 9,400 family and youth engaged. So something to really be proud of. And this was our phase 1 of the program. Thank you. When we were kind of concluding the phase 1 of the program, we wanted to see gap analysis. Obviously, we found a lot of things, but I just want to highlight a few things here. And of course, it's long-term funding, right? We can't quit this. We only started a year ago. Let's move on. Let's find more funding. Capacity building and professionals. Some of the things that they wanted to, the ethnic-led organizations wanted to continue was that model of like capacity building. They haven't had that opportunity before. So like, let's continue our office hours. Let's continue building that professional development. How can we continue? Those were the things that we found. Partnership development, they did want to continue partnering with each other. So that's something that they can still do, but like finding the space to host as a coalition was another one. And going collaboration and coordination within the region. So one thing that, I don't think it's on the slide, but more like, let's connect to the school districts. Let's connect to other sectors, right? Like that are focusing on the work. How can we connect? So those are like some things that they mentioned in the gap analysis. And then fund development, of course, and grant writing, that support, which will be continuation. So when we did this and we were ending the program, it's like, okay, now what are we going to do with it? But we're happy to continue that round 2 of the program now, thanks to CDSS and our partners, and really continue what we have built it for the last, since 2022 September. We're just starting the round 2 of that, so we will continue with same partners and then include new partners as well in all the regions. So we had 45. We're hoping it will go for sure. It's already going up the number just now. And I think that's it for me. I just want to take a moment to thank California Department of Social Services, Magdalia, Carolina, the team, Natasha, everyone. Really, we couldn't have done this work without your help. And it takes a village, and we really see that what it takes. And I do also want to highlight one thing that we co-created also with Magdalia and the team about the delivery. So they're getting like information about our work, continuation of that, and kind of like supporting us through whatever that, advice and things that they have. Thank you so much, everyone. I'm so happy to be here. And our sub-awardees and our regional leads. Thank you.